Dr. Paul here. We have got a rash to take a look at. Let's go take a look. There you are. Hi. So I hear you have a rash that we're supposed to look at. That's pretty impressive, I guess. So my understanding is about a week ago he had an ear infection.
Yes.
And was put on amoxicillin. Mm-hmm. And then last night you were in urgent care?
Yeah.
And what happened in urgent care?
Well, he was coughing yesterday, coughing a lot, but we listened to his lungs and decided that they were clear, and his coughing has gotten better.
Okay.
That was the main reason we came in.
Okay, for his cough.
Yeah.
And he's still taking the amoxicillin from a week ago?
Yes.
All right. Taking some nice big breaths. Good job. Yeah, I would agree. His lungs are nice and clear. Excellent. Skip the lullaby. You want to rock? All right. Are you a dancer? Are you a dancer when the music's good? Yeah. So this rash that we're seeing on his face, when did this start?
This morning. So
Just
we
this
had
morning?
like 2 little dots last night when we got home after
Yeah.
coming to urgent care.
Yep.
And then he had a couple on his face, and then throughout the morning he just got more.
Got worse and worse. So we have some on his tummy. Yep.
Mm-hmm.
Got a few on your tummy. Quite a few on the legs. Very good. So one of the interesting thing, if you want to do a little close up here, this particular lesion has a white center. You know, it's red and then white in the middle. And then if we come to the face, you can see these, like this one here, has a center that's a little bit pale compared to the rim. Have some of these moved
There's
a little
one.
bit? There's another good one for...
Yeah. I mean...
And we've got some raised. These ones are
think
quite
so.
raised right here. So that's very classic for hives. You'll have raised, little what they call target lesions like the one we saw on his face. And outer edges might be somewhat irregular at times. The interesting thing that happens with hives, when you've been on something like amoxicillin for a week, and you think, well, if it's going to be amoxicillin, it should happen right away. Not necessarily. It can happen at any time during the course of that amoxicillin. However, we have to think about what else might be causing hives. Is he on any other medication?
Just probiotics and vitamin D.
Okay, so that wouldn't do it. And, you know, foods causing hives is pretty rare, but you might think of something like nuts, peanut butter, shellfish would be high on the list. Still rather rare compared to, say, an antibiotic. And then the number one cause of hives actually is viral illness.
Okay.
And if he wasn't on antibiotics, I'd be saying, oh, this is probably viral illness. That's assuming I can't find anything else. I'm going to take a real quick peek in his ears. Okay, we're going to take a little peek in your ears. And that one looks just slightly pink, but not really infected. Then we'll slide around to the other ear. And we'll take a look at that ear. That looks okay. So they're healing. You know, if you look at this picture over here, you know, we're looking down the ear canal at the eardrum. And when you have an ear infection, it's this area behind the eardrum that's full of pus. And in fact, people get confused, but the bacteria start from the back of the throat, and they move up the eustachian tube and set shop right there in the middle ear. So probably a week ago, I bet his eardrums looked like this, bulging, angry red. And then now they're just slightly dull. You know, they're not totally gray, but pretty clear. Pretty good. All right. I'm going to try to get a look at his throat. You get right there.
That's tough to do. Can I see your tongue?
Da-da-da-da-da-da. There we go. See?
Got it.
Got it? Sorry, buddy.
Sorry, dude.
He's such a good sport. Okay. Well, what we saw in the back of the throat was basically a normal-looking throat. All throats are a little bit pink. It wasn't angry red. There wasn't a lot of pus or exudate. And looked fine. We've got hives. Fairly classic. The most important thing here is never, ever, ever again does he take a penicillin. So anytime a doctor's giving him a prescription, you say, is that penicillin?
Okay.
Right? Because even the best of doctors, you're in an electronic medical record sometimes, and it's not necessarily flashing lights at you. It's hidden underneath some mouse click. So they're writing a prescription like they normally would, and you should always ask, does that have a penicillin in it? And when he gets older, you'll teach him to do the same thing. We just want to stay away from it altogether. Because subsequent exposures down the road, it could be even more severe. The bad allergic reactions that are scary are trouble breathing. It triggers asthma, or it triggers swelling in the throat. And we obviously wouldn't want that. Now, as far as how we treat this, I think it's not severe. Is he miserable, or is he tolerating it pretty well?
He's tolerating it. He's definitely less energy and sleeping more.
Yeah.
He's not a sleeper, so that's
Right.
kind of nice. But but he's pretty good.
Have you tried any antihistamine like a diphenhydramine, which is Benadryl, or
No.
loratadine, which is Claritin, or the equivalents of any of those?
He hasn't.
Okay.
Yeah, so.
You could try that. 5 milliliters of Benadryl, 2.5 to 5, or 5 milliliters of loratadine, which is Claritin. Now, our cameraman here, this guy right here behind the camera, when he was about your age actually, he had a very similar reaction from sulfa. In fact, the number 1 and number 2 antibiotic allergies is penicillins and sulfa. His was so bad, his feet, there he is, the cameraman. So his was so bad, his feet were swelling, and we were getting nervous that it was going to get to that next phase of scary.
Yeah.
And so in that instance, we'll sometimes use a steroid, like you've heard of prednisone, perhaps. I don't think he's quite bad enough to need prednisone.
Yeah.
That's a judgment call that physicians might make if you in YouTube land are finding yourselves with a bad allergic reaction. You want to run that by your physician. But I think we'll just use an antihistamine. I bet that will be enough. Okay?
Sounds good.
Do you have any questions? Do you have any questions? No? How about you, Mom?
I don't think so.
Okay.
Don't introduce any new foods or anything. Definitely no crazy
Yeah,
things,
that's a
so-
good point. Until this clears,
Yeah.
let's keep him kind of steady, because then you wouldn't know what's
Nice and
causing
plain.
what.
Yeah. Okay.
Very good. Well, thank you for coming in. It's important for documenting. That way we know. So this young man has hives, and he's allergic to penicillin. So this is hives triggered by an allergic response to a penicillin. So what you're going to watch for here is if he develops trouble breathing or trouble swallowing, or if for some reason he's just swelling or his hands are starting to peel, something horrible. It won't happen. He looks like he's going to be okay. You're going to stop the penicillin, the amoxicillin, and that will be out of his system in the next day or two,
that's
completely. And I think the hives will go away in a similar, probably 1 to 2 days, maybe 3 at the most. He's making some funny faces. Maybe 3 at the most. Yeah? Okay. Super.
Yeah.
Yeah, good job. All right, good deal. Well, there you have it, folks. Thanks for watching. I'm Dr. Paul.